Let's discuss some possible problems you could help. First one, torticollis, and that could be a tight sternocleidomastoid and or levator scapula. So right in this region, sometimes it's hard to turn your neck in the morning, so that's more acute torticollis, but some people have chronic where it's hard for them to turn their head at all. Next one, thoracic outlet syndrome. So thoracic outlet syndrome, at the brachial plexus region, right in here, the scalenes could be really tight and impinging that region, or the pec minor could be causing that. Number 3, temporal mandibular joint syndrome. So TMJ joint or masseter could actually be causing really tightness. Sometimes people grind their teeth at night, or lockjaw, any kind of pain in that region. So car accidents can actually cause that too. Next one, frozen shoulder syndrome. So frozen shoulder syndrome, the subscapularis muscle, it's one of the rotator cuff muscles. Sometimes it's hard for you to lift up your arm, so that could be the muscle that's actually causing it. But it's on the anterior part of the scapula, that's where you locate that one at. Golfer's elbow, so that's more flexor tendonitis, right in this region here. Next one, tennis elbow, and that's extensor tendonitis. So it's more the extensors, start over in this region. Next one, student elbow. It's actually bursitis. Sometimes when you lean your elbow on a desk for too long a period of time, it could actually cause those kind of problems. Carpal tunnel syndrome. That's median nerve is impinged. Sometimes it can actually be muscles that can impinge it too. A big muscle in this region, pronator quadratus, could be impinging it. Dupuytren's contracture. It's a fascia tightness of the palm. Some people call it palmar fasciitis. Sometimes it's hard to open up your fingers in the morning, especially people that use tools all day long. Next one, trigger finger. That's also tendonitis. So sometimes your finger gets locked and it's hard to open. Sinus problems, right here. But make sure if it's an infection, you can't do anything with that. 12, vertigo. Stapesius muscle, one of the smaller muscles. Feel dizziness. Groin problems. So that could be a strain or a sprain right in this area. But there's many muscles around here that can actually mimic that kind of pain. So the psoas major can actually mimic it. Iliacus can mimic it. Pectineus. Adductor brevis. So those are just some of the muscles that can actually mimic those kind of pains. Next one, runner's knee, IT band syndrome. So with that, there's a lot of pain along here, and the tensor fascia lata actually connects into the iliotibial band, and runners tend to have that a little bit more. Usually their one foot goes out a little bit, externally rotates more. 15, sciatica. This is on the posterior part of the body. Sometimes the piriformis impinges the sciatic nerve and shoots pain down the leg. Next one, shin splints. And shin splints, usually the tibialis anterior causes that. It can also be stress fractures. So it's minute breaks in the bone that are actually causing that. Tarsal tunnel syndrome, right in this region. And that's kind of mimics, it's kind of like carpal tunnel, but it's actually in the foot region. So pregnant women can have that kind of problem where your foot and your toes start to go numb because the nerve actually gets impinged. Next one, turf toe. That's a sprain of the toe right in here. Next one, plantar fasciitis. 19. It's fascia tightness of the plantar region. And sometimes it's really hard to walk. It's really tender in those areas. Number 20. Urines syndrome. It's pollicis muscle and our thumb sprain. So right in this area. 21. Wingback. That's a weak serratus anterior muscle. And the way you get at the serratus anterior, it's right on the side. That's where a good trigger point is for that. But you can usually tell when people are walking and their scapulas stick out. Next one, dancer's knee. That's really tight quadricep muscles. 23, lumbago. That's tight gluteus medius, psoas, or quadris laborum muscle. So another layman's term, low back pain. 24, intercostals, pecs, interscalenes. Basically any muscles that are connected to the ribs are considered breathing muscles. 25, hockey player syndrome. External oblique tear, right in this area. 26, ankle sprain. And the peroneus muscles on the lateral side, the lower leg, can actually cause that. And or ligament problems too. And 27, rotator cuff problems. Any sits muscle, so either the supraspinatus, infraspinatus, teres minor, or subscapularis can get injured and cause those kind of problems in those regions. Now what I'm going to do is let you look at it yourself and see if you can test yourself on these areas and locate them.